Welcome back to Rohrich Knows Podcast. Hi, this is DrRodRohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Today, let's talk about a very common filler that we do in the office. It's called a lip filler. And one of the most amazing things I see about lips is that they're so often poorly done. I just see a beautiful woman and they come in and it just sticks out like a sore thumb because it's just been overdone. So let me just share with you some of my thoughts and experience about doing lip fillers and the things to do and not do. And I call this the 5-point lip filler. You know, this is what you don't want to do and end up with. This just, and it's not totally reversible. That's a myth behind hyaluronic acid fillers because they become impregnated in your skin and your dermis and you can't remove them. This is not normal. And you know, maybe it's somebody's preference, but this is not a result that I want. And honestly, I will only do what I think looks good. If patients want to have lips done or overdone, I don't do them. I just don't, that's not in my aesthetic. So one thing we have to understand is that as we get older, our lips age too. You know, they get longer, they get thinner, and the lip filler helps the thin lip. But if the lip gets longer, then of course you need a lip lift, which is a whole different topic. But basically, it becomes blunted. And so when you look at that and you look at what a youthful lip should look like, it really should be where the upper lip is about 75% the volume of the lower lip, okay? The lower lip should never be, the upper lip should never be bigger than the lower lip, except for, you know, in giraffes and orangutans, okay? And you should only show 1 or 3 millimeters of incisor show on repose. And that's what should look normal, like this patient. That's a normal repose. And I think that's what you want. And when you see patients like this that have that overdone lip, that shelf look, that is not a normal good look. Now, some patients may like that, but that's not my aesthetic. And if patients want that, I don't do it. And I see that not infrequently. And of course, this you can fix by melting it with hyaluronidase, but it's not a look that I like. This is that overdone vermilion cutaneous border look. It's not a look I like. You know, and you take somebody like this and then you do this to them, that's almost irreparable. And it's just not something that is a good aesthetic. So I just don't do that. Now, if you have somebody like this that just wants some accentuation of their beautiful lip, they have some aging, but you do that, look, now their lower lip is, you know, really more robust. You know, it's actually a little bigger than the upper lip, but there's well-defined lines. That's what you want of the vermilion cutaneous border. And these are all the things that are very important. Your philtral ridges, your commissures, the amount of upper lip vermilion, lower lip vermilion. These are all things that when I look at a patient, these are the things that I imprint, you know, from my brain onto their lips. And there's all kinds of lip injection schemes, and many of them are very, very complicated. But I've tried to set out when I teach it that it's got to be simple to do and follow these axioms. Less is more. The lower lip is 1.6 the volume of the upper lip, okay? And you volumize the commissures first. These are the things on the side of the mouth. If you don't do that, they look weird. So those are some of the axioms. So what do I look at? I look at the commissures. I look at the upper lip vermilion cutaneous border. That's what the area that you want to fill. You look at number 3, the philtral column, and you fill that in gently. And then number 4, these Cupid's bow, just below the Cupid's bow, that pillow. And number 5 is the lower lip pillow that you want to fill in. That gives you an aesthetic lip. That's the 5-point lip. The 5-point lip filler volumizes the commissures, gets the vermilion cutaneous border laterally, but not overcorrecting it, does the philtral column, does the upper lip Cupid's bow tubercles, and then the lower lip tubercles. And those are the key parameters. And when you do that, you work from outer to upper to inner, and you can soften that. So you can really get the commissures, do the vermilion cutaneous border, and you can soften it. And this is all done with a minimal amount of volumizing. I don't use more than a cc of a volumizing filler, and I like to use a hyaluronic acid filler that does that. And I think that's really important. So when I'm looking at doing a lip filler, I really talk a lot about these 5 things. And here's a beautiful young woman that has nice lips, but she really would benefit from having volumization of her lips, modestly in her commissures, in her upper and lower lip areas. So we initially mark the commissures, and that's the area that we're going to concentrate on initially. Then number 2 is really the lateral part of the vermilion-cutaneous border. We do that and just fill it in from lateral to medial. Then number 3 is, of course, the philtral column, and you inject that from superior to inferior, and that really volumizes that very nicely. And then, of course, then below that you do the pillow, the tubercle, and that's right below. That's number 4, and number 5 is the inferior pillow. That's the inferior lower lip portion, and that's really the secret. Less is more, doing it methodically and very based upon the specific problem that the patient has. And in doing so will give you a very nice, natural-looking lip. And I think that's really what you want. You want to volumize so that the lip looks natural and useful. So this is after we've just done some topical, and then we'll begin injecting. This is with a blended hyaluronic acid filler. This happens to be Ultra Plus, and you do it in a cross-radial manner, and that is actually a Nuvive, which actually helps as a vibratory gate theory, where you basically are deflecting some of the discomfort. So you're doing the commissures, and then you're going to do the vermilion-cutaneous border superiorly, and now you're doing it inferiorly, and you're following that thread line at the vermilion-cutaneous border that goes almost to the midline and shaping that area, and that really helps to shape that beautifully, but also using a minimal amount of filler in that area. And then, of course, you will, again, gently massage the commissure, make sure that looks good, and then deposit some in the upper vermilion-cutaneous border, not overcorrecting it, but you're finding that portion that is a vermilion-cutaneous border that goes from commissure up to the lateral philtral column, and soften that. And you can see how you're already getting some volumization in that area. And then you're going to be doing the philtral column, where you're injecting from the feet of the medial correa, going from less, more into this area, and you're going right to the tip of the Cupid's bow. You do this bilaterally, and she really has done well. Obviously, that is the one that causes the most discomfort, is that area. And then, of course, then we do the tubercle right below philtral column. You do that on both sides, and you soften it, and that really helps to shape that beautifully in that area. Then you do the same thing on the lower one, and that really helps to soften the inferior lateral tubercle, which is right below that, and it gives you a nice shaping in that area as well. And this is a small amount of volume. And you can see when you're using this small amount of volume, you can really, truly fill this area and give you a nice look in that area using modest amount of filler. And you can see that just from the volumization you've had on the right, and we've done the same on the left, and we're going to fill the other side now and do the same thing on this side. And you can see the volumization again in the commissure area, and we'll see that. And you can see that this really is done in a very methodical manner to give you the shape and contour that you need, and to give you modest amount of bruising and swelling, but you're following this template so that you get both accuracy and consistency in results. Here you're doing the tubercle, inferior tubercle, and you can just soften that area. And so she now has a nice, robust, natural-looking lip, really using less than a cc total volume, and you can see she has, very nice shape and contour of her lips with a modest amount of swelling in this area, which of course will subside in 2 days. So that's the 5-point technique, and it really gives you a very nice shape and contour that I think really gives you a nice natural result. So these are just some examples of patients that have had, a CC, a filler or less with using this. And again, here's a 26-year-old that had similar shaping and refilling with the 5-point technique. Here's another one that a 19-year-old had another one that had a similar one. She also had Botox to the lower lip muscles that help to elevate the sides of her lips and gives you shaping and contouring. And similarly, another one that had desired central fuller upper lips, and that's where Juvederm Ultra Plus was placed in the central upper and lower lips in the corners of the mouth. Another one, 30-year-old, really gives you shape and contour, just gives you a natural-looking lip, and that's really what you want. You don't want the lip to be outperforming your nose or your eyes, and that's really what you want. And so know before you go, find someone that has expertise and experience in doing this and does not over-volumize and overfill. You can always do more. Remember, less is more. Give me your comments, give me your thoughts, and helping you become a better and more informed you.